Hi, welcome to Case of the Day. Today is the 111th case. Diffuse marrow change. Is this red marrow or diseased marrow? So, we're looking at the second case of this week. And look at these images and see if you can figure out whether this is normal red marrow proliferation or diseased marrow. 13-year-old operated and treated for ostesarcoma of the left femur, presented with a focal right humerus lesion. That's a bone forming lesion, most likely another focus of osteosarcoma. But at the time, she had a PET, there were some findings on the PET, and then she had a whole body MR, and she came to me for an opinion on this whole body MR that had been reported as red marrow proliferation, but the orthopedic oncosurgeon was somehow not convinced. And when I looked at it, and I'm just looking at the pelvis and the spine, on the stir, you can see that there's patchy signal, and we don't really see any evidence of fat. But on the T1, which is perhaps the most important sequence, the signal drop is more than the disc. So it is darker than the disc and darker than the skeletal muscle. So lower T1, and I'll tell you why that is important when we come to this article. So Shivani Alawat has, and she's done some lectures for REF Cafe Rengen. She did this paper, I think, a few weeks ago, um, and it's a lovely paper because it kind of focuses on all these practical issues that we have when we're dealing with marrow lesions. And there is this table that just describes the differences between red and yellow marrow, and then this table flow chart that tells you what to do. So if you see diffuse bone marrow signal on T1, look at the signal intensity, and if it's less than skeletal muscle or disc, as in our patient, and there is absence of marrow fat on stir, we should consider bone marrow replacement or infiltration. And so that's what I did in our case. I asked ChatGPT to summarize all of these findings from the paper which it has done. And again, the T1 signal darker than disc and muscle is perhaps very important. Also, the distribution in terms of if it involves the epiphysis, which it does in our patient as well. And I'll show you that. And if you have a diffusion study, then restricted diffusion becomes a finding. So if you look at our patient here, you've got the increased marrow signal on stir. The T1 signal is darker than muscle and disc, and there are focal areas of altered signal in the epiphysis, which again should have been a clue that this is clearly abnormal. And there was restricted diffusion. So the whole body diffusion that was done somehow did not lend, a proper reconstruction somehow was not achievable. So this is the single station here of the femur, and I've mipped this a little, and you can see this altered signal within. And so to me, this suggested marrow infiltration disease, which I put down in the report. And I think one of the things that must have influenced the original report was that marrow infiltration like this is very uncommon in osteosarcoma. And I think that played a role because, then the question was, how do you explain all of this? There was a PET CT done 3 weeks ago, which also was the reason why the MR was done. And you've got a few patchy areas of increased uptake in the metaphyses here, in the pelvis here. Again, it's very difficult to pinpoint and then say that, all right, this is abnormal. But there were these areas in the right femur, in the proximal tibia as well. So clearly something is going on. And I said, I think we should biopsy this. And this was the lesion with the maximum signal. You can see that a maximum uptake. And so I put the patient in the prone position. This is a non anatomically or non-physiologic biopsy, ideally you should go along the plane of expected um, surgical incision. But in this patient, whether this was related to osteosarcoma or whether it was red marrow, anyway, there was not going to be any surgery done. So then it didn't really matter what route you took. So I used 11 gauge, went in, used an 18 gauge through it, also aspirated blood for cytology. And the answer came today. It is a B cell lymphoblastic tumor, either lymphoma or leukemia, and then they have to look at other tests to figure out which one, whether it's lymphoma or leukemia. So this is not osteosarcoma spread. This is a completely different entity, and clearly now we can realize that the PET is abnormal, the whole body MR is abnormal, and the marrow change is clearly abnormal. And I think if we look at the signs, the T1 less than skeletal muscle and disc, the changes on stir, epiphyseal involvement, and all of these things should help us differentiate red marrow proliferation from disease. I learned something during the case because I had read Shivani's paper earlier, but it all kind of came together with this particular patient. So I thought I'd share that with you. Now this panel is in about 5 days. A lot of excitement at our end because we're all working to kind of get all of this together. My WhatsApp channel. Thank you so much for viewing this.